Hi and welcome. Thank you for joining us today to learn more about the Baystate Pediatric and Perinatal Palliative Care Program. My name is Michelle O'Neill. I am the manager for the program, and myself and some of our other team members are going to talk about our program. First, I'd just like to say that our program is meant to be an extra layer of support. We don't replace any existing care team members, and I like to say we're all in this together. So we're all working together to provide the same goal, which is to promote quality of life for your child and your family. So just to give you a little bit of background and history, back in 2000, the American Academy of Pediatrics met and created their vision for the idea of pediatric palliative care. And basically what they thought about is having a team of people who would be with families when their child is diagnosed with a life-limiting illness from the time of diagnosis through the trajectory of their illness, whether that is through adulthood or through cure or through end of life. And our program is designed to help support families through all of those different facets of their child's illness. So in Massachusetts, we have a community-based pediatric palliative care program, otherwise known as the Pediatric Palliative Care Network. There are 7 programs across the state. All of these programs are housed within a hospice program so that if a child does need end-of-life care, that we're able to collaborate easily with the hospice team to provide the care that the child needs. Our program is funded through a contract through the Massachusetts Department of Public Health, and our program works with Baystate Health. So for those of you in the Western Mass area, we cover Hampden, Hampshire, and Franklin counties, and we are all full Baystate employees. And the services that we provide are primarily provided in the community and in the family's home. So we come to you. You don't have to go to any additional appointments. We come to meet you where you are. So I mentioned a little bit before that the primary goal of the Pediatric Palliative Care Network is to improve the quality of life for the entire family. It's the child that kind of gets us in the door and to meet your family, but we work with everybody through a variety of different services, which we'll talk about a little bit going forward. And through that, we work on trying to meet the unmet physical, emotional, social, and spiritual needs of children and their families. The admission criteria for this program includes individuals during the perinatal period up until age 22. Individuals must be a resident of the state of Massachusetts and have a life-limiting diagnosis that is confirmed by a physician. There is no requirement regarding life expectancy for eligibility. So the Pediatric Palliative Care Program is for children who have a diagnosed life-limiting illness. That phrase life-limiting illness can be a little confusing. So the kinds of things that fall in that category are conditions for which there is a cure may be possible, but not certain. Conditions for which there is no known cure, but treatment may increase life expectancy and quality of life. And for conditions which treatment is palliative from the beginning, things like genetic disorders and neurodegenerative disorders, mitochondrial disorders, or for conditions that may cause life limitation. We also have a specialized portion of our program for babies who are diagnosed prenatally with a potentially life-limiting illness, and the birth outcome is not completely certain. So at the core of the PPCN, the kinds of things that our team focuses on and works with families around are pain and symptom management, family-centered care, collaboration with the pediatric services and all of the existing care teams that are involved in a child's care, psychosocial support, sensitivity to cultural specific needs. We have an interdisciplinary team with many different disciplines working on improving quality of life from different perspectives. Flexibility, our program is meant to meet your needs where you are, and we can increase or decrease and really be flexible to meet those needs in any way that we can, and really focus on living life and living well.
Hi, everyone. My name's Megan, and I am one of the nurses with the Pediatric Palliative Care Program.
I'm Margie, and I'm the other nurse with the Pediatric Palliative Care Program. And we're going to talk to you about the role of the nurse.
So the role of the nurse with the perinatal component of our Pediatric Palliative Care Program is to meet with the family and support you and come up with a plan of care that's consistent with your goals. We know it's really hard to find out that your baby has a potential diagnosis and may have some medical complexities. We're here to support you and work with your family to collaborate with the providers that you may meet along this journey to help coordinate care. We can guide your family regarding upcoming medical appointments and to have some conversations around what your baby's potential diagnoses are. One of the really important things that we can do in your home or wherever you'd like to meet is to help you develop a comprehensive birth plan. And this would include all of the birth possibilities that there might be. We'll talk about your wishes for your labor and your wishes for your baby.
We also provide support to the family when your child is hospitalized. And we help advocate for you and your child, whether you're in the hospital, whether you're at home during appointments. We do not provide skilled nursing care. If you need skilled nursing care and your child needs this, we will help guide you with that, whether it's private duty nursing, skilled nursing visits, or PCA. And if your baby's discharged home, we will continue to follow them and your family through the Pediatric Palliative Care Program.
Hi, everyone. I'm Nori, one of the social workers.
And hi, I'm Kate, the other social worker. Part of the social work role is to provide emotional support. We also do a lot of psychoeducation and counseling for families, especially around creation of a birth plan for our perinatal families. We assist with families in adjustment to the illness of their child and all the different changes, the ups and downs that come with that, and as well as the life stressors that come around with caring for a child with chronic health needs. In addition, we also help connect families to community resources. And if we don't know the answer to something, your social worker is the best person to ask because they will find out for you.
We also do a lot of care coordination with the different providers in the community and a lot of patient advocacy, which is very needed at times. We do advanced care planning as well and end-of-life support.
Hi, I'm Bridget.
I'm Nicole. And I'm Kristen, and we're the child life specialists. And a lot of people don't know what a child life specialist is until they've met one. It's not such a common thing, and not such a common position to run into necessarily. But our job and our role in this program is really to help support the siblings through this experience. We provide therapeutic opportunities for expression and processing their feelings. There's a lot of questions that can come up, a lot of concerns, and adults don't always know how to explain these things to children. And we can help with the language around that. We can help through activities and through play to give them space to express themselves and ask their questions and get the information in the most appropriate terms, in the most appropriate way for that child and for that family. Outside of the questions that they might ask, they might not even know what questions to ask. So we can help in terms of education. If there's a specific diagnosis that a family has and they're not sure how to explain that to their other children in the family, we can also help with that process. Memory making, like journaling, scrapbooking, storytelling, taking photos, allowing them to process what's happening through activities that kids love to do, through that type of play. And that might look different for every family. And then if a baby should die throughout this process as the family is referred to us, then we can also provide the bereavement support. And that also looks very different depending on what the family needs at any given moment. If there are if there's support needed through questions around what happened, what happens next, how to include the other children in the family in that process, we are able and available to help provide that support.
The bereavement support can also happen before the child has passed, creating legacy building with siblings and creating things for the mom, and really making sure that they're prepared if that time does come.
Hello, everyone. We are the music therapy team with the Pediatric Palliative Care Program. I am Amy Kyberdik. I am one of our music therapists.
My name is Joseph Cooper. I'm another one of the music therapists on staff.
And I'm Tim Doak, and I'm the other music therapist on staff. So one of the components that we do have is our Perinatal Palliative Care Program within the Pediatric Palliative Care Program. And we as the music therapists, all three of us offer various types of music experiences for you and your family during the perinatal period. So one of the things that we can do is we do provide bereavement support and legacy building for you and your family. And one of the things that we specifically do are called heart songs, where we can take a recording of a heartbeat from your child and place it into a song of significance, whether that's for you and your partner, or a family song, or even one of your children's favorite songs. And we take the heartbeat and we place it into the song and create that for you to have forever and always. Another thing that we offer is GIM, or guided imagery in music, and this is specifically for parents. And we use Western classical music and creative expression to allow for our feelings and our emotions to come fully out into the world and to be able to process those things. Another thing we do is sibling support, where we provide opportunities for expression and processing of various feelings with the other children in the family, and we use music specifically for that. And another thing that we do is memory making, where we have journaling, videos, songwriting, other heart songs, playlists. We do a lot of various memory making utilizing music. So we're the music therapy team, and we hope to work with you and your family soon.
Hi, everyone. I'm Amberly. I am the massage therapist for the PediPal program. I will be the one that you are working with for massage throughout your time with us. I have been doing massage for over 10 years, and I'm super excited that we are now offering this to our parents in our program. Perinatal massage is for the mom and also available for the spouse. We will need a physician's order in order to start massage, just to make sure that everything is safe to go forward. Once that paperwork is back and received, then we can start working on you, and you can receive all the great benefits of massage therapy. Some of those benefits include stress reduction, reduction of tension in the backs and of the joints. It will help to improve your circulation throughout pregnancy. It'll help to decrease the muscular skeletal pain that you may be feeling with your body changing throughout the pregnancy. It helps to promote healing. It will boost your immune system throughout, and the stress hormone levels, cortisol levels, I'm sure that you've heard of them, will be lowered throughout. Massage therapy can also help with the reduction of gas and any GI issues that you might be experiencing. It will promote a better range of motion, which is the movement and flexibility that you're having, and it will promote better sleep, which we all need more of, for sure. Thank you so much for taking the time to listen to what massage therapy has to offer, and we look forward to seeing you.
Hi, my name is Josh Velez, and I'm with Spiritual Care. Here we promote the spiritual well-being and a better life experience for the family. We perform spiritual assessments and relevant interventions as requested by our families. These interventions may include music, storybooks, games, crafts, attentive listening, and prayer within family values and their faith traditions. We also strive to emphasize our patients' and families' strengths.
Sometimes children do come to end of life while they're receiving our services, and our services do not end during that time. We are able to offer bereavement services for families for up to 15 months following the death of their child. And the services are very individualized based on a family's needs and may be provided by the social worker, the child life specialist, the music therapist, and or the spiritual care counselor, again, based on your individual family needs. We work together with your family to create a care plan so that we identify what those needs are, and counseling can be provided both on an individual basis and on a family basis. And when it's appropriate for children on the perinatal, families on the perinatal portion of our program, we also may refer to a program called Empty Arms Bereavement Support, who are experts in providing bereavement support for families who have also experienced the loss of a baby. And that's a peer-to-peer support program with lots of educational components, and we work collaboratively with that program. If you're interested in the Pediatric Palliative Care Program, a referral can be made by contacting myself, Michelle O'Neill, at the phone number that's listed, or you can email me on my email address at baystatehealth.org. And to summarize, that pediatric palliative care, the overall focus, the goal is to add life to a child's years, not simply years to a child's life. Thank you so much for joining us today and learning about our program.